So good morning or good afternoon, and welcome to this patient live session, which is actually the first one to be held at the International Keloid Symposium. So I'm very pleased and happy to facilitate that. And I'm happy for the patients that they could join, that they would be able to come here. So yeah, I'm very, very grateful for that. First of all, I have no disclosures. And I want to introduce myself. I am Juliette, and I'm a physician assistant working at the SCAR clinic together with both of the plastic surgeons, Dr. Frank Niesse and Dr. Oren Lapid. And I also sometimes work with Albert Wolkerstorfer on the dermatology way of treating keloids, as well as on collaboration in science. And he mentioned actually last Wednesday during our speakers' dinner that I thought I didn't think about that, but probably in the Netherlands, that I am a physician assistant who will be seeing keloid patients for the most times, because I will be treating keloid patients 2 times per week, like full days, 2 full days per week. So I was very humbled to hear that, and I sometimes forget that I see so many patients who suffer from keloids. Within the SCAR clinic, of course, we were supposed not to talk about definitions of keloids, but SCAR clinic is perhaps not the name we should be using anymore, because actually we see most of the times keloids and sometimes hypertrophic scars. And keloids, yeah, they have scar tissue in them, but of course are more than just that, are more tumors. I want to address one of the researches that we did together with the dermatologists, and also with Chi Yen, who also presented and will be presenting today as well. This is a study where we find out that even in the Netherlands, in such a tiny country, we did a survey among dermatologists and plastic surgeons about how to treat keloid patients. And we found out that even in this tiny little country that is so heterogeneous of how to treat those patients, and that can be very affected like on the patient's life. So we were very interested in to find out what that journey is affecting the keloid patients themselves. So from that, we did a research. I talked like enormously about that last year in Shanghai, so I will do it briefly here before interviewing the patients. Keloids come with high recurrences and persisting complaints that can affect the patient's quality of life. Coping strategies can contribute to mental health and adapt to the quality of life. The role of coping with a chronic disease, a tumor like keloids, was not studied before. We found out that some stress factors that patients have to deal with, we did an interview study for that. We had 13 patients with several cultural backgrounds, also different types of keloids, and we found out that we had like several stress factors that they had to deal with. First of all, physical pre-treatment stress factors, treatment-related stress factors. So when they were treated, like, okay, what are the responses there? I've hoped that it will resolve, but like, is it really happening or not? Like, I feel that it's starting to grow again. I feel itch, I feel pain. So that like, they had to deal with that a lot of times. Psychosocial, they were very aware of having those keloids and how that affected also the psychosocial a way of being, so also making connections, and the lack of social support systems, so also with family and friends. The coping strategies themselves were problem-focused, emotional-focused, social support, religious, spiritual related, and they were very avoidant. Of course, I could talk about this way longer, but I don't want to hold you back from letting the patient speak, so I will just briefly introduce it. The coping strategies development, we found results of that early childhood events that were very burdensome effect of how they were, how they were affected by their keloid and how to go on with that. That social context, also families, but also the ability of talking about with friends and everything, that's a part of how to develop and how to get on with keloids, and a cultural background. So at the end, for this, from this study, we found out that it's very important to work towards a more integrated medical system, a more biopsychosocial. Of course, we saw these last couple of days that we all do tremendous work on how to treat keloids and how to make it better. But we shouldn't forget for who we do this and what their voice are, to let them hear and how they experience to be treated. Of course, they also mentioned to raise more clinical and public awareness. As of today, I think raising more clinical awareness is where we will start off with. And we have to find a way of get on a patient support group. So yeah, from here, I will introduce my patients. I let them all please sit in the front. I just want to mention that one of my patients who's here today just got married last week, and we share like a very good connection. So got a bit emotional. It's like she's due in 3 weeks, and yeah, she will talk more about that, why this is happening, because like, yeah, we share a story together, I think. So this is Stephanie. She will, like, I will introduce them shortly later, but I want to mention that it's very special that she's here today. Please all take care. Okay. Yeah. So hi, Stephanie. Welcome. Can you please describe briefly of like since when you have keloids and how many do you have? Isn't working? Oh, thank you. Yes. Can you tell me a little bit more about? Yeah, just yeah. Yeah.
I'm Stephanie. I'm 29 years old, and oh, closer like this.
Good.
I'm 29 years old, and I have had keloids since I was 3 years old. So that's when my journey began. And I think now I have like 10 keloids, and only one of them is stable.
Yeah.
Yeah.
And how many treatments did you get?
I had a lot of treatments in the past, like 13 years. I had like 5 keloid removal surgeries. I had 3 times of radiation. I had multiple times of cryotherapy. I had like, I think, maybe 10 plus years the steroid injections. I had the silicone patches. So I had a lot.
Yeah. And did they all develop at the same time?
No, they didn't. When I was 3 years old, I had chickenpox. That's when the first 2 developed on my chest and on my back. Then I had like a cyst on my ear, but was removed by an ENT doctor who didn't know I had keloids, so that was the next one. And then in 2021, I had an ectopic pregnancy. With which I had an emergency operation. So there I developed 3 more on my belly. And that was it, I think.
Yeah. So that's quite a lot though.
Yeah.
And well, they developed over years, and we will discuss later how that has been affected to you. Is this working? Well, you may pass it to the next patient. This is Sammy. Hi.
Hi, everyone.
We know each other as well for quite some years now.
Way back. Yeah.
Way back. Can you tell me a little bit more about the age you developed keloids for the first time and how?
So right now I'm 37, and I had very bad acne in puberty. I went on Accutane, and then the acne disappeared, but I was left with some keloids. And I'm from Belgium originally. I went to a doctor in Belgium who sort of mistreated me because we didn't know that it was keloid. So he started cutting around it. And then I got like a very big keloid scar on my chest, which since then, I would say for over 15 to 20 years, we've been injecting it. That one and other ones on my shoulder and back. I also had one time cryo, but in general, the injections were the thing for me.
Yes.
Yeah.
And like, how did you experience the fact of that from acne, this could develop? Like, how was that for you?
Yeah, it was terrible. Yeah, because you you try to get a grip on something that you can't get a grip on, and it's and also I didn't know anyone who had it, or there was very little information available. So yeah, it was helpless. Yeah.
Yeah. And you started in Belgium. Did you get in Belgium treatments for keloids?
No, but actually it took me a while to get treatment because there was a big mistrust in the medical field because of what happened to me. And also I didn't really know what was available or what was possible. So it was only after I got some courage and I was already living in Amsterdam that I started like researching, okay, what can be done? Yeah. And then I started in Beverwijk and then I came to you.
Oh, you first started in Beverwijk.
Yeah.
Like, could you find, like, how easily could you find in the Netherlands the place to go to? Like, was it easy to find or not at all?
No, it was not easy, I think.
By family doctor, you got a referral or something, or did you find out it yourself?
I actually, to be honest, I don't really remember how because it's already like 20 years ago. But yeah, it's not that there's a lot of options. Like this is the only option.
True, yeah.
Yeah.
Thank you so much. We will discuss things further. There we have Stacy. Welcome. Thank you so much for coming here as well. Well, she came back to me the end of 25, but we know each other as well for a longer time. I think we met already during COVID or something.
I got it exactly in that time, 2021.
Oh, 21, yes. So around COVID. Well, please, can you also describe to the people who are here of how many kilos you have and since when?
Hi, everyone. Good afternoon. I'm Stacey. I come from, can you hear me clearly? Yeah. Yeah. I started my keloid journey from 13 years before. So it's like 2013. I tried all the different treatment, like what I can get from the hospital. I did like a laser treatment, then the injection. After injection, I tried the the removal, then plus injection. Then after that, I tried the cryotherapy. Then after that, I did like a superficial laser, no, superficial radiation treatment. Then after that, plus the injection and also the tape, the silicone tape, and that's it. Still, I got the scars on my chest, on my back, on my cheek. So still, after 13 years, it keep growing still like this.
And how did it appear to you? Like, what was the cause?
Yeah, also like when you're very young, you get acne. So I got the first acne on my chest. Then it grows like a 3 dot. Then they combine with each other during the treatment. So if I do laser, then it grows bigger. Then if I do removal, it grows bigger. Then it combine with each other. So my biggest scar is like 11 by 2 centimeters. So it's become like a huge area on my chest.
And it was following a treatment, or did it also grow already towards each other before you found any treatment?
Yes, it's just a natural, like constantly it grows. So before the treatment, it's already like a combine, like they are getting closer. Then after the treatment, it just combine, like it become a complete scar.
Yeah.
Yeah. It's a sad story.
And Stephanie, like, can you tell a little bit more about how these keloids affect your daily life?
Of course. Well, it affects me the most in the symptoms I got, like the itching, like the stabbing, um, the pain, where nothing works for that. So the only thing that works is like massage them with oil or cool them with an ice pack. I also had difficulties with sleeping on it because I also have one on my back. I also have one here on my under my dominant arm. So like from eating to putting on mascara or something, I always feel pain. I always feel like also like a nerve pain. And I always tell my boyfriend, like, it feels like someone is pinching me with a sharp knife constantly, like constantly for like maybe 1 hour. Then it stops. And then in about 5 minutes, it starts again. And then I'm only sitting with an ice pack. So that's the most, yeah, how do you say that? Complaints I got, or
Yes, and
how it affects me daily.
yeah, and as well, like you got some treatments for it,
Mm-hmm.
but it keeps recurring.
Mm-hmm.
And are there also sometimes things in your daily life which can actually, well, increase those physical complaints or
Well,
awareness?
increase, I think, stress, then no treatment is working. Yeah, it's not only a cosmetic thing for me, but yeah, you want to look nice, you want to fit in. So there was a lot of hiding in my puberty, hiding, and I always said, like, if I didn't see it, no one sees it. But that has changed.
When
for
did it?
me.
Yeah, when did that change?
I think now for a year because, like I said, I had an ectopic pregnancy in 2021. After that, I had my beautiful daughter. And I think in 2024, maybe, I wanted to get pregnant again. But I still kept going with the steroid injections. And I saw that it was beginning to affect my menstrual cycle with like spotting and some other problems. And I had like 2 miscarriages also. And we talked about that. So we decided to stop the injections and to see what it does with my menstrual cycle and how that went. And like in 3 months, I was pregnant again. So as you can see. Um,
So I think, which is very important as well, to just as a clear message, I stopped giving steroid injections because she was experiencing 2 miscarriages following up, and as well she got spotting. I didn't read about the side effect of getting a miscarriage, but since I saw that pattern, I was like, I'm not doing anything anymore now because, yeah, for her health and for her life, I felt it was more beneficial just to stop for now.
yeah.
And may I ask you one more question? How does the pregnancy, like, does that affect your keloid and how?
Well, I wrote something down.
Perfect.
So I wrote down that, however, I wanted to get pregnant again with my second child. I started to notice that the injections, so like affect my menstrual cycle. Now in this pregnancy, I didn't receive any injections at all. And what I noticed is an increase of growth, yet another recurrence on my back. Like it never seems to stop growing. The itching and the nerve pain during this pregnancy are the absolute worst. Like the only thing that helps is massaging them or cooling them. Um, and so what I said is like every movement I make, like eating or doing something else with my arm, I feel constantly pain.
That's a very important message
yeah.
to share.
Yeah.
And of course, we don't provide steroid injections during pregnancies because we know that the side effect is that in animals, it can give a cleft palate. So therefore, I'm not treating pregnant patients as well as not during lactation. Can you pass it to Sammy, please? Thank you so much. So yes, Sammy, we know each other as well for quite some time. Can you tell us more about how it affected you emotionally?
Yeah,
Thank you.
because now hearing this story, I feel very lucky that I don't have all the physical complaints. For me, it was mostly mental. I missed a lot of holidays or every situation where there was a chance of being shirtless. I would fully avoid. Um, I I'm in general I like control, and this is something you can't control. So I was overcompensating with other things like food or working out because that's something that you can do. But of course, you will never make up for the negative feeling you have with the keloids. So yeah, I would say to this day, like it affects me very much. It's the first thing I wake up with. I check like, okay, what's the status today? Did something grow? Is something new? I was telling Stephanie that I always every morning I look in my calendar. This is not to flatter you, but it's just to see how many days until I can see you, because I really live up towards the day to get the injections, because then I get my fix. Yeah.
Yeah, you always come in and say like, I come for like a fix up, you call
like a
it,
quick,
or something like
yeah.
that.
Like
So
a
it always
yeah.
feels a kind of like a happy moment, because I always feel like, oh, I can
Yeah.
give a kind of a relief, but at the same time, it is weird that you have to come, and it gives stress that you have to come.
No, for
so
me,
often.
like I feel an annoying dependency on this system, because like I feel I can get a nose job easier than these keloid injections.
Because it's a quick
Yeah.
fix, yeah.
Yeah,
And we
because
don't have a quick
no, and
fix.
it is because there's on every corner you can get Botox injections, but like this, I have to wait for 8 weeks every time.
Sorry.
No, yeah, but that's the reality. But that's what makes me very nervous. Like I joke about it, but it makes me nervous every day.
know.
Yeah.
Yeah, and like we discussed that as well for my study, as I know. But how is your support from your family in this?
Yeah, I don't really talk about it because it's very uncomfortable. Yeah, so we don't talk about it.
No, you just therefore also just control other things
Yeah,
in life and hide it, just
yeah,
that's not there.
yeah. Of course, I have some close friends or relationships I had that are aware of it, but still, like talking about it is very uncomfortable. Yeah.
Yeah, thank you. Can you pass it to Stacy, please? Stacy, can you tell us more about the whole journey and how that affected you in your daily life? Because you've done kind of like an international way of treating them. Can you tell us a little bit more about that?
Yes, for me, I did both treatment in Netherlands and also in China. For me, I think mainly the challenge comes from the two aspects. So first, it definitely is the time limitation. Like if if I'm going to take the treatment in China, I have to take like at least 3 weeks days off. Then I fly back. Then I take the treatment. Then it also takes a longer time to recover. Then I fly back to go back to my normal daily life here. Also, when I do the crypto, I didn't expect the crypto therapy. Sorry, when I took this therapy, I didn't expect it. The like a blistering the reactions that stronger level. So I didn't take day off. So I think the time management is a huge challenge for me. And also every day I need to go to work. And also I got a lot of like a business travel. So it's a time management for me, even to take the treatment is a kind of the challenge. And also I got the second aspect, because during my treatment, I met the different doctors give me suggestions and the solutions, what kind of the options you want to take. So during this time, I really need to share this story. It's one of my best memory during the treatment in the past 13 years. So when I did the removal in Wachtingen, the hospital there, after the surgery, it just naturally grow again. Then the doctor, he holds my hand, and I was 22 at that moment. I'm very young. I'm still looking forward to my beautiful life in the future. But he holds my hand and he said, like, Stacy, I have to be very transparent with you. If there is no massive breakthrough improvement for the medical industry in the future, we have nothing to do with your keloid. And I was like, really? You know, that was my zodiac year. I'm very young. And I was like, that's it? So basically, he told me like it's already the end of the treatment. But after that, I noticed, you know, we also got other options, like from social media. You say you can try different options. But at a very early stage, like the doctor shut down the door to me at that moment. So I was like, okay, I feel disappointed at that moment, but you know, along with this medical, you know, technology developed, you still have got the multiple, you know, options for you. So I feel like the hope is still there. So the only thing is you keep trying and trying.
So you hold on to hope.
Yes, a
Yeah.
little bit like this. Like I can't expect what kind of the reaction from the surgery, and I don't know that, and I just need to try. And it's just, you know, by chance, it might work or it doesn't work.
Yeah. And how does these keloids affect your relationships?
I think it's more come from, you know, like I think for me it's more like from the business relationship, like partners. I got a lot of meeting. My job is more like a partner facing role. I need to go to a lot of meetings. So during the meeting, I can feel my partners look at my scar because it's on your chest. It's really hard to ignore you. So they were like, talk, talk, talk. Then you feel their eyesight just gazing there. And you're like, if you want to ask, they don't want to cross a boundary. You know, it's business meeting. They were like, they look at you, then they remove the eyesight, then they concentrate again, then you're like, yeah, you can ask. But also then the question switched to my side. I was like, how I can answer it? It's just naturally growing. Like you don't know the answer, like why you get this. And it's hard to make jokes. Like, you know, it's hard to explain why you get hurt in your chest or on your cheek, on your back. It's really hard to make jokes to make it easy. So that's also for me, like I try to pretend it's not exist, but it do exist. Like people want to know, and you don't have the answer for that.
And do you also still have physical complaints next to that people look at you? Do you also feel them yourselves?
Yeah, also like it's a little bit pressure. You know, when during the conversation, you feel people look at you and they start to get easily to get itchy. Then you want to touch it, but you can't. Then you're like, oh my gosh, should I touch it or no? And it's itchy. And you know if you touch it, it will get worse. You're like, yeah, it's really hard to control yourself. Yeah, a little bit like that. Otherwise, you blame yourself because you stretch it, you know, after the surgery. Then you feel it's all caused by myself.
Yeah.
Yeah.
Sammy, can you tell me a bit more about what for you is the main outcome that you want to get when you get treated for your keloids? What is your ultimate outcome? What are you hoping for?
And being realistic, of course, then yeah, I would just a flat surface. Like for me personally, I don't care about discoloration or different textures. But yeah, I would just like it to be flat. That's what I would like. Yeah, and it to stay flat, not that it's flat for a couple of months and then it starts again. And yeah.
And do you, in your case, do you have sometimes a feeling of how the growth can happen again? Do you experience for yourself what affects it?
Yeah, over the years I had many theories, but it's like it's really not, I can't put my finger on it. Like I don't think it has anything to do with food or certain or like sleep or no, I think yeah, sure it could be stress related, but also this I can't prove it to you.
You have to do more research about that. That's for sure.
For sure. Yeah. Yeah. And it's so random because one spot can be yeah, non-active looking for maybe even a year, and then all of a sudden it's like, oh, let's go again. Yeah.
You cannot tell exactly.
No.
And for you, Stephanie, what would you like to, well, receive as like an outcome?
I think painless treatments. Also that it can get flat. but also for the symptoms.
Yeah.
Yeah, because that's what affects me the most, like the pain, the nerve pain, something for that. And I would like to see that, like the doctors are not only treating the scar, but treating the whole patient, like emotionally, or with a psychologist or something, like on the whole team, because it's not only the scar you have, it's like
Also, how it
a lot more. Yeah.
You say that very well. And can you tell us a little bit more about what helped you through your journey?
What helped me is that I always had a support system. I always had my family around me that also always said, like, you can achieve everything you want. You're good as you are. Makes me emotional.
Yeah, that's very beautiful and very important. Hmm.
And also for my husband, my daughter, my second daughter.
That's beautiful.
It's not about the support.
No, for you, not. No.
Always there.
Yeah, that's really great. So for you, that helped you a lot. That's beautiful.
Yeah, it keeps me going.
Yeah. And from the medical field, what has helped you in that and what not?
So I wrote something down about that.
A whole list.
So I've always been happy that here at the hospital that you wanted to try also with me, like what treatments are working for you and what not. So I never thought you were giving up on me. So we always like, okay, let's go again, or let's try again, and maybe this time, maybe this time. And I wrote something down, like for you especially. It's just a little. Oh yeah, I wrote down like the only thing that always eased these consultations were the conversations with you. The time, the calmness, the way you did the treatments, the injections, the kindness she gave unconsciously, perhaps consciously too, were always indescribable. The interest she always showed in my private life and how, and without, I have to say something, she could see in my eyes how I was doing in the game. So thank you for that.
Thank you so much. That makes me almost starting to cry again.
It's support too.
And what can we actually do better? Yeah, I will do that. Thank you. What can we thanks? What can we actually do better? What could we do?
I think, yeah, more research, more awareness, and yeah, maybe more people
Yeah.
to work with it, because I always said to you, you can't leave here.
Yeah.
You're the one that I got for this, and I think there's no one else.
Thank you so much. You said it very well, very beautiful. Thank you. And for you, Sammy, what helped you through your journey, and what could have been done better, or what can we do better?
I think especially, let's say the beginning, like 15 years ago, I think it would have been nice if there was a bit more like mental health support. Like I've gotten it later, also when I had the resources for it, but I mean, it would have helped me tremendous if there was like a connection, also for that part. Yeah. And it would also help me if you see me more often instead of every 8 weeks. Yeah.
And can you pass it to Stacy, please? And for you as well, like what helped you and what can we do better?
Yeah, I think helped me. They're very two important things. One is then like the insurance systems as well. So, if the payment get covered by the insurance, you feel more, supporting, financially support. And also the second one is the accessible level to the hospital, because you need to regular go back about the aftercare part. It's not just the one surgery, but I think the real battery field is in the care. So you need to constantly go back to the hospital to track how it goes for your scar. So I think for me, these two parts is very important. And in the future, I would say, so first, if we can have like a booklet, like with the pictures, like, to give the patient a clear expectation. Actually, how to value if the surgery if it's a successful one, or if it's a forward one, with the pictures, then you can have a better overview before the surgery. I think it will actually help for me. It's helpful for me. And also, for example, like a patient group, like we can share more experience. I think it's really important. Because, on social media, you pay all the fancy pictures, good pictures. You're not going to show the picture of your scar. I think in China, especially nowadays for our social media, we do share, like, the people have the keloid, we take picture and we share our experience at the hospital. So you search it in the social media, then you can actually see it. But unfortunately, like when I go back to Netherlands, I live here for 9 years. If I search keloid on the Instagram, I wouldn't say like people share their experience. It's very private. So I was thinking, if we have like a patient group to share the experience, that will be really good direction for us in the future.
Thank you. And we have a new patient coming in. It's not my patient. Can you briefly introduce yourself and tell us what kind of keloids you have and for how long?
Okay. Hi. My name is Omi. My surname is Itsweli. So my name is Omi Itsweli. I am from Nigeria, but I was born and pretty much grew up in the UK. But I was going back and forth as a child between the UK and Nigeria because my whole family is pretty much in Nigeria and from Nigeria. I'm actually here with my mother today. So, mommy wave. So that's my mother. So yes, I have a great support system. My parents, my family, they're all very supportive, and it's emotional support really is very important. I think everyone has said it in one way, shape, or form, but I just really need to explain that it's really important that you guys, as medical practitioners, don't just come at us like we are something to solve. We also have feelings and it matters. And our experience, because you guys don't know as much as it's not so certain what you know and what you don't know, our experiences matter. Don't just think I'm the doctor in this. It's important you really hear us and make us feel like we live with it. So you have to hear what we're saying when we say this works or this doesn't work. Or if you're trying to convince us of something we don't understand, don't just come at it with, well, you don't know what you're saying. I know what I'm saying. Come at it with, I think this will work because I understand you might not be feeling like it will, but let's have a conversation. Don't just talk to us like we're subjects for you to figure out the cure.
Thank you, Omni. And for how long do you have keloids?
I've had keloids. Well, my first keloid was on my ear because my mom, in Africa, we tend to pierce the ears of girls pretty much quite early. So I was very young. I don't even remember how old I was when my mom pierced my ears. So I had the first one from piercing my ears. And it was funny because you pierced both ears, but this one had a really tiny dot and then nothing. And this one exploded. So it's interesting. And I've had about 10, 15 keloids all over my different parts. So I went from just the ear to nothing. And then puberty, I came with acne. And then the acne turned into keloids. And I had to learn how to treat the acne so that they wouldn't turn into keloids, because you can treat them so that they don't become keloidal if you know what to do, at least in my case.
What kind of treatment did you get for the acne then?
Well, for me, it was just basically TCP or Dettol. So I would literally keep cleaning it and keep cleaning it and keep cleaning it. I would even pick at the scab until it healed pink, and then it would be fine. I didn't even need to have anything particularly special. You just keep cleaning it. You can, as long as whatever was inside is out, it won't turn. If it can heal clean, it won't turn. So for me, I found that if it can heal with, my body wasn't getting rid of whatever's in acne. So if you can get rid of it for it, it'll go.
Thank you. May I ask you to pass to Sammy again for me, please? If the audience should remember one thing of your story of treating in the future, what would you let them know?
I would say the mental health component. I would say it should be, and maybe that's for every patient different, but for me, I was really, really struggling. So it would have been nice if there was at least a question asked, like, what is it doing to you? And do you need help on that part? I think that I mean, I'm fine now, but it would have been very helpful.
To get that earlier in your
Yeah.
journey. And for you, Steph, how has that been for you?
What I just said is like treat the whole patient.
So
The whole
actually the
patient.
same. Yeah.
Yeah. And the research is very, very important. And maybe just to start with why some people develop them and some people not.
Thank you. And for you, Stace?
Yeah. Yeah, after hearing these stories, I feel, everyone's doing the test. Like we never know what's the consequence, where it turn good or bad. Yeah, so I do think, the communication with the doctors become very important part. Like when we do the injections every 4 weeks. At beginning, it's every 6 weeks. Then we turn to the every 4 weeks. The customized solution depends on my case. It makes me feel more confidence. Like I come back, because for patient, we also invest a lot of our times to do these things, and we take risk. We want to be the part of the experimental of this treatment, because I do think it's like from both sides.
Thank you. And for you, Omni, if you want to give the audience like just one kind of sentence of word, like of importance of treating patients with keloids, what would you suggest them to be aware of?
I think it's most important at the moment. Maybe in the future it'll be different, but at the moment, if we all admit that we don't have the answers, and I mean, even on my skin, the same treatment applies differently to the different keloids, and it's the same body. So just because you have a good idea doesn't mean it's a good idea for me. So if we can just come at it with help, just let's always have an open conversation and be very transparent from the beginning of what you think you can do and what you think you can't, and ask as many questions as possible so that you can get as much history as possible, because sometimes we don't even know what to tell you. So it's not that we don't want to tell you everything, because we don't know what you need to know to help us. So the more you talk to us, the more we will say stuff and you will hear stuff, and then you'll be like, oh, okay, this could work, and maybe that will work. And it's just, it didn't occur to us that you needed to know that. And we don't know what, nobody knows. It's clear that there's no book that we'll all read and be like, okay, this, then this, then this. And it doesn't work like that. So just keep talking.
Thank you so much. Of course, I want to ask the audience if some of you have questions for them or for me, to wrap it up a bit. Okay, where to start? Tracy, where can you help me?
There, it's over there. The cash box, it's over there.
Quick questions for the audience. Lamont, please.
Yeah. Where's Tracy? Well, hold on. Oh, yeah.
First, I want to commend you all for your courage and your resilience, not only living with this disease, but to have the ability to sit in front of us and tell your stories. In this room, there's a lot of people from different disciplines looking at keloids, and my question for you is, what tools, what things could we be working on to help you in your journey? I mean, ultimately, we like to have a a cure or treatments that have better results. For the most part, if you look, we've been doing the same thing since the 1920s, 30s. I mean, there hasn't been a lot that's changed. So as we strive to get better treatments, what kind of things could we be working on to help you along your journey?
I would say two things: the just availability of getting an appointment, like not last minute, but not because sometimes you have a reaction in your body that maybe happens 2 days after you had your appointment, which means you have to wait for a very long time until you can see your doctor again, which is very frustrating. So I would say if there would be a possibility to book it like a dentist appointment or a hair appointment, that would take away a lot of anxiety, I think, for patients. And the other thing is, this is the second time in my life that I speak with someone that I know of has the same disease. So it feels very an isolated issue, and just I get so much already from this day talking to these girls. So some sort of patient connection, I would also say, would help me a lot.
A community.
Yeah.
Thank you very much. May I make a suggestion that if you have questions for the audience, only one of you respond to that. Otherwise, this will go on for a long time. John, you have been waiting to.
I'm a cancer surgeon, and I got involved in an odd way. And
Microphone.
I find treating patients like yourself and helping you gives me as much satisfaction as cancer patients. I want to ask you, the gentleman in the middle, you told a very sad story about your life and how it affects you. Have you ever been offered radiation treatment?
No, I have not.
Guess what? Well, in the permission of Dr. Turgan and Julian and Juliette, I'd like to invite you all to listen to my talk this afternoon, because you might get further comfort from what I can offer. We all have in this room something to offer. We're all special.
Is it going to be videotaped? Because I can't be here in the afternoon. I can watch it.
Everything. Thank you very much. Yes, everything is being videotaped on Zoom and would be available on YouTube, and we share all of that with you. Up higher, please.
I just wanted to answer to Michael. We have tried radiation. We went to India actually when we got tired of the treatment in the UK and Nigeria. So we went to India, to the Apollo hospitals. I was telling you about it. We had the best of doctors. And they decided that we could do radiation. And on the shoulder here, Omi has one, large one. It was a little keloid here, and tiny little keloid. And it was, we thought we should use the smallest of the keloids because we didn't want the larger ones used, just so that we don't create a bigger problem there. So we used the smallest of the keloids at that time. And the doctor said radiation would work. And we were happy for that because we had not used radiation in the past. We'd used the 5FUs. We've done lots of cutting. She's had about 16 surgeries. So the doctor suggested that, and we said, Eureka, that's why we're here. We tried it, and it was worse. The burn, it's sort of all over, came down from the shoulder where it was right down to here. I must say that I don't know, like I said, we went to one of the best institutions in India, so we know that the doctors there were good or supposed to be, but we don't understand why it went that way. I must admit as well that although it's increased the space of the keloid, it hasn't grown as fast as, say, your chest, but it did spread, and then it left a terrible, ugly, black color burn. And that was what we had with radiation. So we're also afraid of radiation right now. So we're not ready to try radiation in any other way. Mm-hmm. So whenever you speak of radiation, I wonder, why did it go wrong with us? Thank you.
Thank you very much. We have to just make a quick comment. If radiation was answer to everything, we would not be here. This conference would not take place. Everybody would go home. All the patients get radiation. Everybody would be cured. You know, that's not the answer. That's why we are all here. So we need to have an open mind to everything.
Thank you. We have a question up there. Yeah.
Thank you very much also from my side for coming. I'm Alexander Nast. I treat keloids in Berlin at the University Hospital, and I do a lot of injections, and I'm aware of all the pain I'm creating with the injection. So from your experience and also from Juliette's side, do you have any recommendation on how we can reduce injection pain? What has been the best way to inject you with as little pain as possible?
Okay, I will try to explain. Because I had the injections, first of all, with Dr. Frank Niesen. And after that, with Juliette. And I saw a major difference in like how deep you're injecting. And how hard you're injecting. And I experienced with Juliette that she's like, she has a very soft way of giving the injections. And she doesn't give them like very deep, like I don't know how you say it, but aan de, hoe zeg je dat, echt op de oppervlakte, zeg maar?
Do you mean more like that you experience that it's intradermally, like that in the skin itself, that it doesn't feel deeper for you?
And that worked more for me. I saw
But you also applied some lidocaine cream prior to the visit, right?
always lidocaine cream, always. That works also for me.
I was going to say that I've done triamcinolone with 5-FU and I couldn't take the pain. So I always had to have local before. So I always got local injections. I don't like injections, but by the time you're done injecting me with the anesthesia, I'm fine. You can inject me as many times as you want. You can pick me anywhere, everywhere. I'm all good.
Yes. Yeah, that's what we also do for the combination. But for the triamcinolone, we don't do it because, of course, a new injection hole can probably in the area, you know, you're always afraid of something. But for the 5-FU, we do. And for the cryo and the excisions.
They used to mix my triamcinolone with the 5-FU for me, because I know you're not my doctor, which is why I'm explaining. So I used to mix the triamcinolone and 5-FU for me, and then the doctor would give me, I don't know what anesthetic he gave me before, but he would give me anesthetic he would pick an area, because there were so many areas. We would pick an area to do on a particular day, and then he would inject the entire area, because my areas are so large. He would inject the entire area with the anesthetic, and then do the 5-FU, because usually the doctor's office was about an hour away from my home, well, 30 minutes from my home. By the time I got home, I'd be in pain.
Thank you. Do we have another question?
Yes. Hi. I was just wondering whether you would consider doing occlusion for someone who's pregnant. So I know she can't do injections right now, but just to mitigate her discomfort during the 9 months, maybe you could occlude it with the Duoderm during this time.
Yes, I have the silicone patches. That's what I use.
Okay.
Yeah.
Thank you very much. I would like to make one comment. And again, I don't know any one of you as a patient. It takes a lot for a doctor to provide advice to the patient. So the advice I give to my own patients, whom I know, who deal with a lot of issues that you all deal with psychologically, is that do not let the disease or the treatment stop your life. You need to live a normal life, as normal as possible. You're at school, you need to do your studies. You're at work, you need to focus on that. You want to have a family, you want to become pregnant, you want to have a child. We stop the chemotherapy, we stop all of these because you come first. Your life comes first. You need to make sure that gets done properly, the best way possible. If you're afraid of people seeing you when you go to the beach, wear a UV suit, but go to the beach. If you're in a meeting and people are looking at this, wear something, wear a turtleneck. So people don't look at that, look at your eyes and see you, not your condition. So these are the advices I have for my own patients, that these issues come up and they need to be able to deal with that.
Thank you.
Omi, please.
Yeah, sorry, I just wanted to add that I'm sure they could probably all agree, but I found that for me, what helped was quote unquote developing my personality. I found like I have friend groups, and it was really funny to me because I would be like, "Oh, I remember like 2 months ago I had this keloid here, and I had it cut off," and they'll be like, "I don't know what you're talking about," because they started to see the person and not the disease. So I find that everywhere I go, I have to remember to be the person and not what I have. And the more I talk to people and they get to know me, the more they forget what I look like.
Thank you so much.
Thank you very much. I want to thank all of you for taking the trouble of coming here. We commend you for having the courage to sit here and openly discuss what your life has been, how your life has been impacted by this condition. I truly thank you for all your efforts and only